Back on the program to speak unedited about the upcoming legislative session is State Representative Melissa-Provenzano from Tulsa, Assistant House Minority Leader. Thanks for coming back. I appreciate it.
Thank you for having me. Oh my goodness.
Yeah, it has been a while. Let
Yeah.
me ask, because we've got a lot of things to cover, what would you say the Democrats' top 3 priorities are? We're hearing a lot about education reform for sure.
Yes, and that's one of them, but we're really focused on, everything costs more than it did a year ago, and so we're focused on paychecks that can keep up with that. We're very much interested in raising the minimum wage to $15 an hour. We're also interested in making sure the big corporations are charging a fair price for energy or utilities, whether you're a big customer or a small customer, and just as well as back to that cost of groceries, what you're paying at the grocery store. We're starting to see a trend rolling across the country of surveillance pricing based on an algorithm of when folks are coming in and bumping that price up, based on the time of day or based on who you are, and we don't want that to happen here in Oklahoma. And so those will kind of just be our top focuses. And education is always, we're a caucus that is full of educators, and so we've been thinking a lot and listening a lot to what the Republican plan is, and have our own thoughts on that.
I was going to ask, before you were a legislator, you were an educator.
I was, yes.
And I'm wondering, what are your thoughts on the Oklahoma Competes plan that they seem to be embracing? Especially, are we ready to hold third graders back again? Boy,
let's dig into it, shall we? So it's based loosely on the Mississippi plan, and the state of Mississippi did have some successes, but what we're seeing with the data is that the third grade retention piece isn't where the success was being found. It is in that early targeted intervention. And catching them early between kindergarten and the first grade. And so we've got to start the screening much earlier, and third grade is just too late. And it is important to remember that just 2 years ago, we had that in law and we repealed it because kids in third grade were pulling their hair out and crying and stressed, and parents and teachers spoke loud and clear that this wasn't working. And so when you look at the plan, Democrats will be rolling out our own comprehensive plan over the next week. This next Wednesday, you'll see us roll out something like that. But we've got to invest new dollars, and we need to do it for the long haul. We can't just do it for this session. If we can have an 8-year plan for bridges and roads, we can do it for kids. And so we need sustained investment. We need sustained plan instead of just changing things up every 2 years because a legislator wants to get reelected and we say, look, we solved education. and we've got to involve the parents, especially in that third grade retention piece. Long before retention, but a parent needs to be at that table and understanding and on board if that ultimately has to happen. But then if you look at it, if we hold a student back, who's going to teach them? We've got to solve the teacher retention piece first, because who is that student returning to? If you're in a rural area, is there only one third grade teacher in your school? Or are they emergency certified? Have they been well prepared? How do we prep the teacher corps to be able to absorb this, and how much is it going to cost to add an additional year of education to that child? We want to get them what we need, but we believe the path is through early intervention. And so, and just remember that, everyone that's in the legislature now, that was in the legislature in 2024, voted to repeal, except for 6 members over both bodies. And so it had overwhelming support, and I believe that it'll be a conversation that's critical to have again.
Well, I was going to ask you, is the entire Democratic caucus a no on holding back kids, or are you all leaving this to individual members and their individual feelings?
I think as Democrats, we don't say you must vote this way or else. That would be fun to do if we could make everyone lock up like that, but it is a conversation that we're having and exploring the ins and outs, and we're more focused on pushing the positives, the early intervention, and instead of saying we won't do this or we will do this. I think we pigeonhole ourselves and make our universe much smaller when we tell people how they should be voting.
So I know another issue that you all are concerned about, and I've even asked the Pro Tem and the Speaker about this.
Yeah.
The big beautiful bill is shifting a lot of responsibility for what I'll just call social welfare programs
to
the state of Oklahoma. And they have already said, we cannot just pick up where the government left off.
Yeah.
What are your concerns with we cannot pick up where the government just left off?
Well, so I'm remiss to be critical of anybody, but the federal delegation hasn't done its job. We have people coming to us just with general health care concerns, and you've seen premiums here in Oklahoma. Just in my district, I get calls every day on my premium has tripled, my premium has doubled, and I'm having to drop to catastrophic care or no care at all. And we're going to be absorbing that one way or the other. And the state budget this year is not what it once was, and so it'll be tough to absorb that with our budget, and so that's going to be passed on to Oklahomans, and then it's ultimately going to find its way to the emergency room because that will be the only care people can get to.
I know you all have been concerned about rural hospitals.
Yes.
Can you explain what is the concern here? Because the argument on the other side is, well, we are getting some dollars coming in that we haven't before.
Sure.
Please lay this out for me. I'm a bit confused.
So with the big beautiful bill, we had all these cuts to Medicaid, right? And a lot, I want to say close to $7 billion of those cuts was in direct payments to hospitals for their Medicaid patients, Sooner Care here. And so we lost $7 billion. Now granted, we are getting I want to say over several years, 1.1 billion back. So there's a $6 billion gap there, and I hope that rural can absorb it, but I don't see how. And so it's important to remember that $7 billion is what we were getting, and now we're getting $1 billion. And granted, we were in the top 5 of who all got what, but it's a little underwhelming.
Let me, because SNAP is mixed up in this, and I think we were all shocked to see just how many Oklahomans need SNAP to eat.
Yeah.
Are you thinking that they're going to be cutting recipients on some of these programs, whether it be SNAP or other things?
I can't answer that. I think the blowback was so vocal and fierce, similar to the healthcare insurance. Who knows what the federal delegation will do, but I know that what the state can't absorb, then you'll see our food banks absorb, and then the food banks will be coming to us to ask for funds. And so it's just a big old cluster, honestly, and I have to wonder where all those federal tax dollars are going, because they were appropriated to begin with, and we were going down this road. And to not provide food to families that need it is not something Democrats can stand for.
So let me ask you, you were on the investigative committee for the Mental Health and Substance Abuse Services.
Oh boy.
We kind of put the Band-Aid on it, hoping this session. Do you think we can finally put this baby to bed? Do you feel like you have all the answers?
No, not at all. Actually, I still have deep concerns. We still can't produce a budget. Their budget hearing is this next week, so we'll see what they have to say. But there were a lot of deep cuts that needed to be made, and then some got called back based on who you were and who you knew, honestly. And that concerns me as well. But we have several mental health providers across the state, our CCBHCs, that aren't getting the support that they need, that they were promised. And when we asked for a list of the cuts, it took, just a comprehensive list. It took months to get that from the new delegation. And so, I feel like it can't be that hard to balance a checkbook, but it is not something that's going away, and I'm concerned that it is expanding.
Will we see more investigative hearings, or will you ask? Okay.
I hope so. I think there's a lot of fires that need to be put out, a lot of agencies that haven't had the attention that they need, that we'll be focusing on, because we won't have a choice to do otherwise.
So let me ask you this, and I apologize, I'm going to go over my time limit here, but I am curious about what do you when it comes to the homelessness issue. And I know a lot of Democrats in Tulsa have felt like they've been under attack by Governor Stitt. This is the blueberry and the tomato soup. Yeah. Is there any answers or solutions or new help coming to Tulsa with our homeless situation from 23rd and Lincoln?
Well, at the state level, I think we've taken a deep dive into, look, I know Representative Schreiber, I don't have her bill number at the top of my head, is looking at ways that we can get credits to home builders and make different places more accessible to getting into, and so you'll have to ask her about it. That's not my superpower, but I do know that I've seen at the city level, a serious ramp up in my own district at 61st and Memorial. I see roofs going on Vista Shadow Mountain. Yeah. I see new windows going in, and I've got to give major props to city officials for the action that we haven't seen in some time. Now, we'll have to stick with it because, you know, things can go off the rails, but that matters to me. Because it's what you can see it and you know things are happening, and so we're working on cutting down the number of units that we need here, and that also goes with homeless situations. There's a lot of big feelings that Tulsa area representatives have based on the governor's actions late last year, because all of those folks that were homeless are now back in those spots. And the state now has a $500,000 bill to show for it. And so many people lost so many personal belongings that they needed, medications, documentation, in order to be able to get a leg up and to get into housing. And so it just has been a very frustrating thing that I think will continue to dig into.
We are out of time, but we will be watching.
Thank you
so much.
Thank
I
you.
appreciate it.